Welcome to the Prepped and Polished podcast, the podcast that empowers you to take control of your education. Featuring weekly interviews with influencers in the world of education, as well as tutoring tips, lessons, and updates. And now, here's your host, Alexis Avila.
Hi everyone, this is Alexis Avila, Prepped and Polished, a tutoring and test prep firm that provides in-person and online tutoring for the exams. Private entrance exams, college entrance exams, grad school, and academic subject tutoring, one-to-one always, math, science, English languages, study skills coaching. For more information, please check out preppedandpolished.com. And while you're there, sign up for our monthly newsletter. Just go to preppedandpolished.com. Get to know the Prepped and Polished community. You can find us on Facebook, Prepped and Polished. You can go to Twitter, we're at Prepped Polished. And Instagram, Prepped and Polished 1. To our listeners, you can submit a question at any time to radio@preppedandpolished.com. I love hearing from you. I welcome you to the Prepped and Polished podcast, where we interview amazing and inspiring guests in the world of education, as well as offer tutoring and test prep tip podcasts, update podcasts, as well as our Celebs Giving Back series, where we focus on celebrities who give back to the world in a positive way. Joining our show today is Rebecca Manley, founder of the Multi-Service Eating Disorders Association, also known as MEDA. MEDA is an eating disorders nonprofit organization in New England that provides education about eating disorders and their underlying causes to develop a compassionate community that promotes hopefulness and supports healing. MEDA offers a variety of services to support individuals and families through the various stages of their journey. A little bit about Rebecca. Rebecca's published curriculum entitled Teaching Body Confidence has been featured on televised news programs, World News Tonight on ABC News, 48 Hours News on CBS, as well as many other national and local stations. On today's episode, Rebecca talks about how the eating disorder landscape has changed over the last 10-20 years, the struggles students with eating disorders face, and some strategies to help overcome these disorders. You're going to learn a lot of valuable information. Rebecca, thanks for coming on the Prepped and Polished podcast. How are you today?
I'm fabulous. Thank you. How are you?
Not bad, hanging in there.
Great.
Can you focus on a couple of pivotal moments that brings you here with us today as founder of the Multi-Service Eating Disorders Association, also known as MEDA?
Sure. So the organization was founded in 1994, and the original name for the organization was actually the Massachusetts Eating Disorders Association. And in 1999, we changed our name, and we went more of a national presence. With the internet and with web presence and with becoming more known on a national level, we changed our name to the Multi-Service Eating Disorders Association and started promoting our services more outside of Massachusetts, within the Northeast, and on a national basis. In 2002, we received the Family Advocacy Organization of the Year Award, and that was a really great time for us, and it really gave us a lot of media exposure as well as just more exposure within the Northeast. In 2004, we celebrated 10 years of services and expanded our current programming, expanded our clinical services, and expanded our educational programs. In 2013 was a particularly meaningful time for me, which was the elimination of BMI report cards for the state of Massachusetts, which we worked really hard on getting those eliminated. And then in 2014, we expanded our offices. We were originally located in Brookline. We moved from Brookline to Thornton and Pearl Street in 1996. And then in 2014, we moved to the corner of Newtonville Ave and Walnut Street in Newtonville. And we have more space for support groups and professional training, as well as more space for staff.
And it's right next to that beautiful new Newton North School.
It is.
Nice.
It's right near that gorgeous Newton North High School.
Nice. Now, what types of services does MEDA provide, and do you work with people of all ages, females and males?
We do. We provide a number of different services, and we absolutely work with males and females. The organization is broke up into 3 separate branches. Our first branch is our educational part of our mission, where we provide workshops, training for school personnel, for students, for guidance counselors, for other nonprofit organizations, for hospitals, for treatment programs, and anyone else who's looking for more education around eating disorders or body image training for their students or their staff. We also provide consultation on developing a body confidence day for high school students, training students to work within the school system, to put together an entire day of activities that surround issues around body confidence and body image. The second part of our mission deals with our clinical services. We like to think of ourselves as the first step in getting support. So if a loved one, a family member is concerned, they call us, and we can help them navigate the very tricky treatment process and make it easy for them, or easier. We can provide assessments where an individual will come into our office and they might, gee, do I have an eating disorder? Do I not have an eating disorder? What's going on for me? What might be helpful? And we can help them figure out what would be the best type of support for them. We also have coaching sessions and skills trainings. We have consultations for individuals and family members. And then we also provide a number of different support groups for teens, for families, for younger adults, for older adults. So we have support groups almost every day of the week. And once a month we have a free support group called Hope and Inspiration, which is completely anonymous. It's free. You come and listen to someone who's fully recovered. You hear their story, and it can be helpful for family members. It can be helpful for someone who's struggling, giving them hope that they don't have to live with this their whole life. It can help people just learn more about eating disorders, and it's a really great group that we offer. And then the third part of our mission is our professional training branch, where we provide training for those working in the field, social workers, mental health counselors, psychologists, physicians, nutritionists, coaches, anyone who is working with individuals who might be struggling with eating concerns. This weekend we have our national conference where we have professionals from all over the United States come and get training for the weekend, hear the latest research, hear the latest treatment methods and case studies, and learn and become inspired to be the best clinicians that they can be. So that's this weekend at the Needham Sheridan. And you certainly can find more information always on our website at www.medainc.org. And you can learn more about what we offer there as far as clinical trainings.
Amazing. How has the eating disorder landscape changed over the past 10, 20 years?
You know, when the organization was first started in 1994, the numbers of individuals that we saw were less. We saw very few males. And we also, it was very rare back then to see a client under the age of 14 years old. Now in our office, we see males, we see children as young as 9 or 10, and we're seeing more and more.
Oh my God.
When we're just seeing more different cultures. We're seeing more people, and if you look at, interesting data is from the Massachusetts Youth Risk Behavioral Survey. And in the most recent behavioral survey, 47% of high school students are currently trying to lose weight. And I think that number has substantially changed. I think there's more pressure on our young people to be a certain body type, to be thinner, and so that statistic has definitely changed. 10% of those students are trying to lose or control their weight by fasting or going without eating, and that's a pretty high number. And so these are the types of things that have really changed over the past 20 years.
Wow. And what are some of the common myths or stereotypes associated with a student coming to you with an eating disorder?
Yeah, you know what? There's a lot of those. There's a lot of myths. One is that eating disorders are just about getting attention, and someone thinking, oh, that person just needs attention, and so that's why that he or she is doing this, and that's absolutely not the case.
Wow. Yeah.
There's a number of different reasons why people develop eating disorders, but there's a genetic and biological component associated with eating disorders. And so people don't just wake up one day and decide, oh, I'm going to have an eating disorder.
Right.
This is something that they don't choose, because if you've ever had an eating disorder, you would never choose it. And so, you know, that's one that's really very important. Something else that's important is that men don't get eating disorders, and that's absolutely a myth, that men absolutely do get eating disorders. It's actually, that myth has been detrimental because it's perpetuated in our society so greatly that men oftentimes are less apt to seek treatment because they think, oh, I can't have an eating disorder. This is a woman's disease.
Right.
And so, you know, that's really important to note.
Wow.
Recovery from an eating disorder. Some people think that there's a myth that people can't recover, and you absolutely positively can recover from an eating disorder. It's so important that you get treatment sooner versus later. The sooner that someone gets into treatment, the better and quicker chances of recovery. So that's really important to know. And I think another myth is that only people of high socioeconomic status get eating disorders. You know, eating disorders affects all cultures and all classes. And it is not something that is only wealthy white families that are affected. Another myth is that men who suffer from eating disorders tend to be gay. Sexual preference has no correlation with the development of an eating disorder. And so I think that's something that a lot of people believe to be true, which absolutely isn't.
Sure. Wow. These are amazing. One of those myths that I find fascinating is that you can't overcome an eating disorder, because I find that a lot of the TV, you know, Lifetime specials, and, you know, they're so negative, and the student ends up, you know, dying.
Right.
But what I'm hearing from you is that's not the case. You can
People absolutely can get better. And, you know, you have to think about, you know, a lot of the programs that you see on TV are sensationalized, and they do talk about worst case scenario. And there are certain people who will struggle their lives with this, but that is more uncommon than it is common. It's important to get treatment, and it's important to get treatment as soon as you can, and it's important to stay into treatment because it's a very difficult, once an eating disorder takes hold, it is multifaceted, and it requires different types of treatment for different types of individuals.
What are some sure signs that you may have an eating disorder?
Yeah, you know what? There's a number of different signs. Like emotionally, someone who has, you know, a change in their moods. Their moods are kind of out of control. They're having difficulty managing their moods. They're talking about their bodies a lot. They're obsessed with how they look or their weight. They're talking about dieting. They're starting to avoid foods because they're too fattening. They're eating small portions, or what they once were eating has now changed. Maybe they have odd food rituals. Maybe they're only eating certain foods or with certain people or at certain times. There's a sudden weight loss or weight gain or fluctuation in weight. Someone who's complaining of abdominal pain or feeling bloated, feeling cold and tired all the time, feeling fatigued or dizzy, obsessing about food, weight, diet, or exercise, missing out on family events or social events because of wanting to exercise, or not wanting to go to these events because food's going to be present, and constantly talking about food, or constantly cooking but not eating. So it's someone whose their life is revolving around food, weight, diet, or exercise.
Oh, okay.
Does that make sense? So it's someone who really, they're starting to cross the line, and it's interfering with other things in their life.
Their daily living.
Exactly.
How much of a role do parents play in this? When a student's diagnosed and treated with an eating disorder, do you find that the parents of these children are generally supportive? Are they a problem? What's the role?
This is interesting, because this goes back to some of those myths we were talking about. Is that, I think a number of years ago, especially when I first started the organization, there was kind of this philosophy and theory that parents caused an eating disorder, or a child had an eating disorder because the parents had done something. And that is absolutely not the case. Mm-hmm. Parents don't cause an eating disorder. They can be very effective in the treatment process, however. It's just like anything. Every parent is different. Sometimes there's denial. Oh, no, he or she's just dieting, or no, he or she's just having a hard time, or so there's this denial about the seriousness of the eating disorder. That can certainly happen. For the most part, from what we've seen, is that parents have been although scared and upset, because it's mm-hmm. devastating to watch someone you love and care about either refuse food or use food to cope with strong feelings and emotions, and it's hard to watch. Mm-hmm. Absolutely. So it can be very difficult on parents, but we found that parents are been very helpful in the treatment process. We have a group at MEDA called our CARE group, where it's a group for parents and significant others that they can come and they can learn how to be supportive. A lot of times parents don't know what to say, or don't know what to do, or even how to eat with their child. And these are all things that we can help guide them and help support them, because that's just as important as the individual with the eating disorder getting help, is that the family gets help as well. For individuals who are older, who no longer live with their families, it's still important for families to get educated and get support, because at some point they will be together for family holidays or other family gatherings. So it's helpful for them to get the education and support that, and to be knowledgeable about things that they can say and do that will be supportive and validate the person who's struggling.
Wow. Okay, so we talked a little bit about males also struggle. Some males can struggle with eating disorders. Yes. How so? So
males struggle just like a female would with anorexia nervosa, which is someone who is restricting the amount of food and calories that they're taking in, or bulimia, someone who either binges on food and then tries to purge by various means, and that can be exercise, or someone who might binge and then starve themselves, and then binge eating disorder, someone who binges and then doesn't use means to purge. These are all types of eating disorders that affect men. The increase in men that we see in our office, I would say, starting is about 2 to 3%. There was recently a large-scale research study done that talked about male body image concerns over the last 20 years, and the the study showed that there's been an increase from about 15% about 20 years ago to about 43% of men now struggle with some type of, body image concerns. So there's been a real shift in our culture around how men perceive themselves and their, their message to look a certain way. And, I also think a lot of it has to do with how men are taught in our society to deal with their emotions. And men culturally are taught not to be sensitive, not to talk about their feelings and their emotions, but everybody has them. So if you don't talk about them, you don't learn effective coping strategies, someone could use food to cope with those, because that's really what an eating disorder is. It's not about food. That's just how someone is. That's their voice that they're using is the food. But it's not about the food. It's about their emotion. It's about something's going on inside of them that they feel unable to communicate. And so they use food to cope with that. And if you think about it, have you ever been really, really hungry? Really hungry.
Yeah.
When you're really, really hungry, it's hard to think about anything else. It's hard to think
Sure.
about what else might be bothering you. It's hard to think about other thoughts and feelings that you have because you're thinking about food. There's also, if you're really, really hungry, you can numb out. You can completely, not think about, your thoughts and your feelings. You are completely numb. Or someone who is overeating, it's metaphoric for kind of stuffing their feelings down and not having to think about uncomfortable things that are happening.
Wow.
So, men just like women struggle with these feelings and can become addicted to not the food, but addicted to the behavior surrounding the eating disorder.
And I'm sure the males, the body ideal is they're trying to look like, Arnold Schwarzenegger in the 80s,
Right.
Obsessive working out.
Right. Well, there's obsessing working out, but there's also the thinness factor and the fit factor, and our cultural ideal of what is beautiful has totally changed. And that's also more pressure for men as well as women.
Absolutely. I know this is a very general, quite loaded question, but what are some of the best ways to treat students with eating disorders?
Yeah. So, because everybody is different and because different types of treatment work for different types of people.
Sure.
But because eating disorders are multifaceted, they require a multifaceted approach. So at MEDA, one thing is certainly to have an individual therapist, someone who can help figure out what is going on and what role is food, diet, or exercise playing in your life. So individual therapy, seeing a psychiatrist possibly for medication is another part of the treatment process. Seeing a nutritionist, someone who can take a look at their food and what they're eating and maybe help them to make choices that feel safe but will also keep their bodies healthy. Absolutely seeing their primary care provider, their physician, making sure that they are physically healthy. And then our support groups. I think I mentioned earlier, support groups are really helpful in breaking the isolation associated with eating disorders and getting people more connected. People who are struggling with eating disorders feel so isolated most of the time. So being with people who are struggling and going through similar thoughts and feelings is really helpful in the recovery process. We also absolutely recommend alternative treatments in conjunction with individual therapy, like yoga, massage, acupuncture, Reiki. all those types of alternative methods have been very helpful to people who are struggling with an eating disorder.
Do you offer or do you recommend teen groups where the teens are together with their peers in a group situation, or would that be too like a devastating thing?
It's an interesting question. So it would really depend on the teen and where they are at and what they're struggling with and where they are in the recovery and the type of individual that they are. That's why meeting with one of our clinicians in our office, we have fabulous clinicians that work at MEDA, and they would meet with the teen, they would meet with a family member, a guardian or a mother or father, and try to figure out, okay, would a group be helpful? Okay, these are the groups we would recommend for you. And for a lot of teens, our teen group has been a fabulous part of their recovery. The groups don't talk about food and weight. What they do talk about is they talk about thoughts and feelings and what teens go through on a daily basis. And being a teen in our culture is very challenging. And so our groups can be helpful, but certainly if a clinician feels like a group wouldn't be helpful at this time, then it might just be part of the treatment program would be seeing their individual therapist or along with a psychiatrist and their primary care physician. Sometimes we see teens in our office for an assessment, and we say, you know what, they really need a higher level of care. They need to go into a hospital or an outpatient program that has a little bit more structure until they are at a point where they are medically safe. So sometimes that needs to happen.
Definitely.
And there's fabulous treatment programs, and MEDA is connected to all the treatment programs in Massachusetts, Northeast, and nationally who specialize in eating disorders.
That's amazing.
So we're definitely a wealth of information.
Yeah.
Because it can be challenging and very overwhelming for a parent.
Absolutely.
Or a loved one.
Rebecca, what's the most rewarding part of your work?
I would have to say the most rewarding part of my work has been seeing individuals and families that MEDA has treated come back years later to volunteer and share their story and make a difference. I think that's probably been the most rewarding part.
Fair enough.
Yeah.
Can't get it better than that.
Yeah.
And what's the best way to get a hold of MEDA?
The best way to get a hold of us is either through our website or by calling us at 617-558-1881. That's 558-1881. And if you want someone directly, you can hit extension 12 for the office coordinator, and they can hook you up with one of our clinicians, Jamie or Rachel, or our executive director, Beth Mayer, all of whom are easily accessible and available by telephone. Or, of course, by email. You could always email us at info@medainc.org, and someone will get back with you within 24 hours.
And to the kids or teens listening to the podcast today, any advice before they cross that bridge into young adulthood?
Yes. Like I said earlier, it's very challenging. It's very challenging in our culture right now to be a teen. And, I think one of the things is to talk about your feelings. If you're feeling stressed, if you're feeling overwhelmed, talk to somebody. Find an adult that you trust and talk about your thoughts, your feelings, and your emotions. If you're having a difficult time, handling what's going on, and you're having a difficult time figuring out healthy coping strategies, if you find yourself, coming home and, eating because you're having a stressful day at school or not eating because you don't feel good about yourself, let someone know. Talk to somebody about it. Figure out some coping strategies that work for you, whether that be going to a yoga class, walking, or seeing a therapist or your school counselor, figuring out what works for you, what you can do to, in a healthy way, to manage your emotions. Something else that's really important for teens is spend some time unplugging during the day, getting off your phone. You know, if you're on Instagram or Facebook or Twitter or whatever, and or Vine, and it's starting to make you feel bad about yourself, you're feeling worse, you're comparing yourself to what you're seeing on Instagram and comparing yourself to, gosh, all those kids are having so much fun, my life doesn't seem fun.
Mm-hmm.
If you're finding that that's making you feel worse, unplug, stop looking, take a break. Same thing with magazines. Fashion magazines. There was a large-scale research study done at Harvard about college students, male and female, who they surveyed their self-esteem before looking at fashion magazines, and then did a survey of their self-esteem after looking at fashion magazines, and found that they felt worse. If you feel worse after looking at any type of media or magazine or something on the internet, take a break, stop looking. You also don't have to buy it. Make a statement with your pocketbook. Manufacturers, advertisers, you are a target.
Sure.
They want to make money, and they're looking to you to buy their product. So if a certain company or a certain style of clothing is promoting thinness and the perfect body and makes you feel bad when you look at it, don't buy their product. And lastly, do things that help you feel good in your body. Don't use exercise to punish your body or to try and change your body. Use it because it makes you feel good. And figuring out things that you like to do that make you feel present in your body and help you to feel good. So those are just some tips and some strategies, and you can certainly always call us at our office, and we can give you some more tips and strategies as well.
Fantastic. Rebecca, thanks for joining us on the Prepped and Polished podcast. Appreciate your time.
Thank you so much. Thanks for including us.
And this wraps up our show today with Rebecca Manley, founder of MEDA, the Multi-Service Eating Disorders Association. To learn more about Rebecca's amazing work with students and adults with eating disorders, please check out MEDA's website, www.medainc.org, MEDAINC.org. And check out episode 63. We'll be doing our next tutoring tips episode. Thank you for joining us on the Prepped and Polished podcast. Now go out there and take control of your education.
You've been listening to the Prepped and Polished podcast. For more information, check out preppedandpolished.com. Also, you can follow us on Facebook and Twitter. Thanks for listening. Class dismissed.